terms of opioids, it's important to know that some of our main concerns include the fact that opioids are known to be quite addictive, they are habit forming, and people develop a tolerance to opioids, rendering them less and less effective over time. So when it comes to opioids, those are risks, and they also carry a significant side effect burden, which can include severe constipation, to the point where some of our patients have actually had significant gastrointestinal problems because they are not able to have a bowel movement after surgery. Opioids really slow things down in the gastrointestinal tract, so it's important to note that if you are taking these medications, you really want to keep a close eye on when was your last bowel movement, and if it's been a few days, certainly start adding medications such as a stool softener, a laxative. Sometimes a suppository can also be very helpful. The muscle relaxants also have some side effects, which mostly include fatigue, lethargy, and simply feeling somewhat emotionally blunted. With both of these medications, we recommend that you do not drive while you are taking them, and return to driving should only be when you are no longer taking opioid medications or muscle relaxants. There are also concerns too with increased doses of ibuprofen, particularly with patients with a cardiac history. So you need to be careful because increased NSAIDs or ibuprofen can also cause some problems in the stomach lining. And we tell patients if you are taking high dose ibuprofen or steroids that you should also take something to protect your stomach lining. And that can be purchased at any pharmacy over the counter, such as a proton pump inhibitor such as Protonic or another antacid. Increased Tylenol doses can also cause liver problems, so you really want to make sure that you are not exceeding the maximum daily dose of Tylenol, which is 3,000 milligrams per day. And if you are taking 3,000 milligrams per day, we would really only recommend that on a short-term basis. Now, the day after your surgery, you will receive a phone call from one of the nurses at our office. They will be getting an update on how things are going for you globally, but they will very much be prioritizing your level of pain and what you are taking for pain medication. This is a wonderful time, again, if you feel like your needs are not being met with your current pain medication regimen, to discuss it with your nurse, and then the nurse will discuss it with one of the providers here at the office, and we can make dose adjustments, including an increase in dose, and also, once again, we also have the option of changing the medication altogether.